Good morning once again. This is Perspectives on Invicta 98.9. As you may well know at this point, Tuesdays and Thursdays are special for us as we have the COVID-19 awareness brought to you by the Kaduna State Ministry of Health. Today is one of those days that we talk about COVID-19 on Perspectives and to discuss the progress made and where we are with COVID-19 in Kaduna State. This morning is Dr. Musliu Kolawole Odunla. He is a consultant, orthopedic and trauma surgeon, as well as public health physician. He is also a member of Kaduna State COVID-19 Committee on Risk Management. Thank you for joining us, Dr. Odunla.
Thank you very much, sir.
All right, so let's get to it. Where are we with what progress have we made in recent time in Kaduna State as regards COVID-19? We see a situation where, the government is taking it more serious. The face masking and the protocols are taking, there's a bit more enforcement on the use of face mask in town. Where are we with, what kind of progress have we made in recent time?
Thank you very much. The Kaduna State government, like other government all over the world and states in Nigeria generally, have had a resurgence of COVID-19, what we term second wave. What it means is that there is an increase in the incidence and in the number of cases as if it were when the pandemic started in February, March. The unfortunate thing about this particular second wave is that there is a strain, a mutant strain of the virus, which is more, that causes more fatality, that is resulting more complications in terms of disease complication affecting the individual, and the risk of dying from the individual is much higher. There is a newer strain from UK, there is another mutant strain from South Africa. So putting all this into action and the fact that vaccine is just coming up and we have not had vaccines here in the country, Kaduna State government have no other option other than to enforce those preventive measures. Preventive measures still remains the cornerstone of preventing community spread, limiting the progression of this particular virus. So you mentioned face masks, and I'm happy that was your first point of call. Face masks have been found to effectively, more than 99%, if used properly, prevent the transmission of COVID-19 virus. Since we know it's a droplet infection, and when people sneeze, when we talk, remember that even if you talk, there is some droplets of fluid that has a trajectory and can actually go into the air and affect individuals who are even within the confines of their room. So enforcing face masks is mandatory and it's nothing new. It's a global thing, and I think we should act responsibly by using that simple face mask. Apart from that, the government has introduced enforcement or penalty for people who default. I don't want individuals to look at this penalty as witch hunting or trying to make life difficult for us. If we have a choice, if we have to choose between enforcing face mask and paying penalty for it and going into a lockdown, I'm sure the experience we had during the lockdown is not palatable for everybody. For the health workers, it has affected businesses. We are just recovering from that painful decision. I think most individuals would rather prefer to comply with the use of face masks, using it properly. We have all various forms of the way we use face masks. One, let me just quickly take you through how effective use of face masks can prevent COVID-19 virus from spreading. The first thing you do before you don your face mask, a face mask is a device or a material that is made from a cotton or is made from a fabric that can be used to protect your nose, your mouth, and to the bottom of your chin. That is the extent of coverage for the face mask. It must be neat and it must be new. Now, the first thing you do is that you wash your hands. Hand washing still remains for most infectious disease, Lassa fever, Ebola, yellow fever, including cholera, washing of hands with hands and soap has been found to eradicate most bacteria, most viruses and spores in more than 99% of cases. So you must wash your hand properly. Then when you are downing your face masks, you use the medical face mask that commonly in circulation has two surfaces, one inner white surface and an outer blue surface. So it is the inner white surface that you actually put inside and the blue surface comes out. If it is green, it is an inner white surface and then the green outer surface. Make sure when you are putting your face mask, you use the string around. Don't touch the surface of the face mask with your hand and don't allow any other person to touch it or contaminate it. And then you put it. Now, the question now goes, and that does not stop you from performing other protocols that you need to observe. Social distancing is very, very important. This will limit the contact, since it can be transmitted human to human by touching your face, by shaking your hands. So social distance is important. Etiquette of respiratory hygiene, when you need to cough or sneeze into your elbow, cough into your elbow, and kind of lower your head. That actually prevents most times. And then the other thing again is that avoid even touching. The fact that you have put off your face mask, if you must touch it, use the string and not the frontage of it. You should know that the surfaces of our offices where we stay, there are viruses, there are bacterial spores spread all over. So if you touch it and you think you are free, you will just be contaminating yourself. And then by the time you use your face mask for 4 to 6 hours and you speak through it, you walk in the sun, it becomes damping, it becomes wet. It calls for change. It means you have to change the face mask. But we've seen people using one face mask over and over again. And that is why I'm happy with the improvisation by our ingenuity of the masses and the fashion agencies that have reintroduced cotton mask so that people can cut, have about 5 of it or 6 of it, iron it, and then you can use it as the day goes by.
Well, I'm glad that you took time to narrate or tell us how to use the face mask properly, because that's one problem that we've seen over time. We've seen people use the face mask, lower the face mask to probably the chin level or underneath, and just leave it there, and sometimes beneath the nose. And it just stays there, and then you wonder why they have the face mask on if it's not actually going to protect you from what you're taking. Now let's get to the fact that I like the fact that you're also a trauma surgeon.
Yes, sir.
We've seen people, go through isolation and all that stuff, and somehow, it's been said that there's a bit of trauma that comes with, being infected with COVID-19. For those who may have experienced COVID-19, we've seen a lot of people, including celebrities, who have experienced COVID-19. How can one, deal with the trauma, the after effect of all the traumas that come with, being infected or being with somebody who has been infected?
The trauma in the aftermath of suffering from COVID-19, isolation, and the treatment one goes through is quite enormous. They are both physical and emotional. The physical mainly comes from the damage that is caused on the lungs of the individual. The hallmark of COVID-19 is the damage that is being done to the lungs, because in an attempt by the body to combat the disease, that is setting up systemic inflammatory response, what we mean an attempt to fight the disease, the hallmark of it is that it damages the lungs, and it causes cloggedness of the mucous membrane, the alveoli where air are trapped, bleeding, and that is what causes damage to the lungs. And that is where, as respiratory physicians or as trauma surgeon or any doctor that has been trained to tackle chest injuries or any kind of intervention in the chest, we may have to find, particularly the anesthetists, the critical care people, that the one they will now be called to intubate the individual. And intubation means we are taking over your respiration. When you intubate, you are not breathing by yourself. The machine is doing it for you. That's enough trauma. At times, you may have to put a chest tube, that is to drain some fluid. If we have the capacity, we might use what we call a bronchoscopy. A bronchoscopy is an endoscopic material in which you will assess the lungs through the nose or through the mouth in order to go to where those blood clots and mucus are, and you extract them. These are highly skilled procedures which can be done. Apart from that, the emotional trauma is another major thing that people go through. And in that case, it's a multidisciplinary approach. As a clinician, a public health physician, and a trauma surgeon, we have been trained to handle stress, either physical stress or emotional stress. Physical stress, yes, we intervene. Emotional stress, we use our psychological know-how in conjunction with the neuropsychiatrists and the psychologists to actually, one, make the individual accept that you have the disease and you can come out of it. And when you come out of it, there is no stigma attached to it. That's one thing I'm happy about COVID. Initially, when it came, I remember I just came back from the US and I was just they were about closing the Nigerian Airways. I went for a 3-month fellowship course. And when I came back, people were sort of, I had to isolate myself, do all sorts of things. And I saw how family members and people were running away from me. So it's quite emotionally tasking. And that is what we did as risk management and media people in the COVID-19 committee to ensure that there is no stigmatization, just like the HIV, AIDS, Lassa fever, and other things. Just keep that distance, maintain all the protocols that you need to maintain, the individual will recover. So it's a multidisciplinary approach. At times we have to bring in the neuropsychiatrists, the psychologists to work on the psychology of the individual. Because it is said that experience, somebody may have a lasting experience of a sickness or of an event, and that translates into how it will relate with individual. It could become paranoid, it could become withdrawn, it could become so fearful that it cannot perform its normal activity. So that's a very good area which we should intensify. I think we only focus on treating the individual, getting them out of the hospital, leaving them traumatized, and not taking care of the psychological
Absolutely.
aspect. So I'm happy now, you brought it up.
I would also want for you to, clarify for those who may not have experienced, the severe COVID-19, would they also have, that kind of physical trauma that you mentioned, especially with the damage in lungs, and all that? For those who experience the milder symptoms and all, would that also be the same effect that they would experience?
Those that have mild disease, the good news is that the strain or the severity of the disease in Africa and sub-Saharan Africa generally is much milder. About 90 to 95% of people have the milder disease, and it can be passed off as a common cold or malaria, and they just got burnt off and they never knew. For those that have this severe disease, some will be isolated some will be admitted and will require critical care. About 2 to 5% will require critical care, and those are the ones that suffers that. For those that do not require any critical care, they are the ones that tend to say, we don't believe I had this thing and nothing happened to me. We should be thankful to God that it has made our own strain or the clinical presentation of COVID to be a lot milder due to various factors which conspiracy theories have brought out. But we are not here to discuss conspiracy, we are here to discuss facts. How that happens has to do with so many scientific factors, and we may not know the reason why this in Africa the severity of the disease is not as much as in the temperate country. Research is ongoing. People have attributed the use of BCG, even the malaria infection that we had, where our immunity has been boosted. They are just speculations until we have facts. So apart from the trauma to the chest, individuals who have severe COVID can suffer stroke. Yes, they could have one half of their body will be paralyzed, because there is what we call endothelial damage. Means that at the cellular level of the individual, the basic unit of the individual, cells are damaged. All this inflammatory process takes place in the lungs, in the brain, in the blood vessels, and blood can clot, goes into the brain, and the person will suffer what we call cerebrovascular accident and hemorrhagic bleeding into the brain, and he becomes paralyzed.
Doctor, some of these terms may be very difficult for the layman to understand.
What I'm saying is that there are reactions in the blood clots, in the blood vessels. Because that the virus has been detected in the blood, will trigger some kind of reaction to fight against it by releasing antibodies against it. During the course of doing that, you could damage blood vessels, and then there will be platelets. Platelet is an agent that helps to contain bleeding.
Okay.
So it's activated during this particular course, and that has been found to cause blood clots or excessive bleeding, and that can go into the brain. Just like you have somebody who is hypertensive and the blood pressure went up, and then one of the vessels get busted in the brain. So people with COVID can also have stroke, what we call cerebrovascular accident, bleeding into the brain, either from a blood clot or a massive bleed, and then one half of their body is paralyzed. So when they recover, it's a very serious trauma. So you may have to bring in the physiotherapist to assist them in coming out of it. You should also know that the physiotherapist, that is the physical therapist now, and people who are involved in rehabilitation, are also involved in managing hospitalized COVID patients, because they require chest physiotherapy, chest exercises, and they are the people that are trained to do those chest exercises in order to prevent fluid from collecting in the lungs because of prolonged immobilization. They lie down on bed for a long period of time, intubate them, and that could also cause further damage to the lungs. So even if they have been discharged, you still need to treat, because those complications are still real and they can occur. Let me give you an example. For example, you traveled over a long distance in an airplane or in a car, and you are above 60, and you don't move your limbs. Blood clots can collect in your legs, and the man arrives at his destination and he's just moving, and they'll say he collapsed. It is because of the blood clots in the legs that has gone to block the lungs, and the person can die a sudden death. I won't use the term that is being used, but it's just like a blood clot dislodging and blocking a part of the lungs. So if the individual is discharged, it's not yet Uhuru. It should continue the chest physiotherapies. It should talk. It should, even those that are on isolation, if you remember, we do tell them to move around, massage their legs. You don't go into isolation and you sit in one place. Already there's an ongoing disease which can cause blood to clot. And if you don't move, then you are encouraging the blood to clot. And people will die from complications of blood clots that will go into the lungs and kill them rather than even die of the COVID.
Absolutely interesting, Dr. Odunlala. Thank you so much for bringing fresh angles to this, because a lot of people who present with some of the symptoms just feel we'll just take care of ourselves and not even go ahead to test. We'll take a break. When we come back, we'll talk about issues around testing and all. Stay with us. It's perspectives on Invicta 98.9.
Invicta FM.
Welcome back to the program Perspectives. Today is Tuesday, and this edition of the program is brought to you by or sponsored by the Kaduna State Ministry of Health. We have been looking at COVID-19. We're talking about the risks, the traumas, and everything that people experience during COVID-19, and how prevention is the best form of, protection against COVID-19. People should not wait until clinical interventions are brought in. Let's do what we call preventive intervention, so that this disease wouldn't continue to spread. We have been talking with Dr. Musiliu Kolawole Odunlala. He is a consultant orthopedic and trauma surgeon, as well as public physician. He is also a member Kaduna State COVID-19 Committee on Risk Management and Media. Thank you so much again, Doctor, for being here and the fresh angles you brought to the conversation today. Now, before we went on that break, we were going to talk about testing and how some people present with symptoms but refuse to get tested because they're afraid, they don't want to be stigmatized against and all that stuff. Can you tell us why it's important for people to test when they, present these symptoms that could be similar to common cold and even, malaria? How can we, why should people go to test for COVID-19 rather than just resort to self-medication?
Thank you very much. That's a very pertinent question. And just like you said, COVID-19 mimics common cold, malaria, and so many other things. So how do you distinguish? Yes, we know that part of distinguishing COVID-19 from other illnesses require the symptoms the patient presents with, the clinical evaluation by the physician, but testing remains the cornerstone to confirm a case of COVID. So you combine the clinical findings, cough, catarrh, shortness of breath, tightness of the chest, and then fever. At times you don't wait for all those symptoms to materialize. Once you have any 3 or 2 of those symptoms with fever and you have had contact with somebody or you are coming from an area, Kaduna State is one of those, is trailing behind FCT now and Nasarawa. So once you meet that criteria, it is important to go for testing. The reason why you need to test is to know the test might come out negative, and that is it. If the test comes out positive, it means we are not stigmatizing you, we are only isolating you from the general populace and your workplace so that you don't infect others. The danger is those carriers that are positive have not reported for testing and they think everything goes well. They are the potential people who spread the disease. And they are the people who lead to community spread. Once there is community spread, it becomes very difficult to contain. And we have elderly people, we have pregnant women among us, we have people who are diabetes, we have people who are on cancer medication, we have people who have renal disease. Their immunity is already compromised. And you allow those asymptomatic or even symptomatic carriers to move in freely. It's not. Nobody is confining you to a prison now. You can even self-isolate at home. I have a medical officer who works closely with me in a very big institution. He just come out of isolation 10 days. Just this morning he's telling me he's out of isolation. He's been isolated for 10 days. He's awaiting his second test to be sure whether he can resume full work. Nothing has happened. So I will advise those individuals to go for testing. Now the question again is that testing is not as painful as people thought. When we initially started testing people using the throat swab and then using the nasopharyngeal, the nose, and then, with training, the technique of testing has improved. And people are now more vast, they are more, it's not so, it should only cause some discomfort, but not pain.
Well, I like that point because recently we've seen videos where people who went to test were, afraid, but after one person had the test, and it's not that painful
really
anymore. It's not that painful,
Exactly.
So people fear sometimes because they don't understand. And there's also this speculation that some of the test kits may have been contaminated. And when they use those test kits on you, maybe a person who may not have the virus.
False positive.
Exactly. So how can you confirm this and make sure that this doesn't happen?
I'm happy you brought out that issue because the conspiracy theorists are some of the tools they use to say that we give wrong results to people, we do certain testing deliberate. There is, if you know the training that goes with the laboratory people and even all of us, that goes with us, we do constant training and retraining on the technique. We ensure that, one, everybody that is coming for test has a unique number that is unique to that individual anywhere in the country. What we call epidemiology number. That number is unique to you and cannot be shared by any other person. Then if we can take precaution how we wear face masks, you can imagine the precaution we take doing testing of individual. So those, we wear our protective gadgets as much as possible, at all times when we are doing this testing. We use goggles apart from the face masks, and we use our gloves. And each glove is disposed. As we are using one glove, you are discarding. You are testing it. There is an assistant who collects it, break it, put it, label it. So we ensure human error can occur, but that has been taken care of to the barest minimum. So even if they occur, they are not going to be at a very large scale that will affect the outcome of our testing. We are aware of human error, and we are doing everything possible such that if we suspect there is something wrong, we'll cancel all those testing and ensure that we conduct another test for individual. It has happened. And we should know that this test, there is still no guideline completely as regard who bears the cost. But for now, it's the federal government and the state government that bears the cost, especially for the community testing. And each test on the Naira level is between 45,000 to 50,000 for an individual. So you can imagine if institutions, workplaces have to be tested. You understand what I'm saying? So government is actually paying a lot. But for people who would travel, they have to pay by themselves. And then for now, we have testing area in the Barau Dikko Specialist Hospital. We have a testing area in down Kaduna South where the isolation center is. And then there are some institutions that we actually go, communities. We have various communities, local governments are covered, and we have individual that has been trained that will go to those communities to screen or test those individuals. So there is a lot of economic effort and human effort in conducting these tests, and it's quite enormous. So we should encourage them rather than discourage them, so that at the same time again, training, new skills should be acquired to the already added skills. So we do virtual meetings, we do virtual training, and then we do individual training again. When we notice there is some mishap somewhere, we call in that particular local government and retrain them and impact more knowledge to them, because we cannot afford to commit mistakes, deadly mistake at this time.
Amazing work there. Now let's bring you into the conversation. You may have heard something new on the program today, and you have questions. The numbers to call to be a part of this conversation today, they are the same numbers that we've always had. 081 40,000 989. That is 081 40,000 989 and 070 87 800 989. 070 87 800 989. We're taking the first call. Hello, good morning.
Hello, good morning, sir.
Good morning. Welcome. What's your name?
Thank you. I'm Isimodu calling from Idi Musa Mando.
Isimodu, you have a question or comments to make?
Yes, I'm having a question and a little comment.
All right, go ahead.
Concerning this corona that we are talking, is government serious for the coronavirus to go? Because if they are serious, please let me ask, why our flight flying from abroad into Nigeria from different countries that they have that pandemic? When it started, they have locked all the airports and no one is flying. But up to date, we are seeing flying from other countries into Nigeria. What lesson have the government taken from the past lockdown, and what are the measures are going to take now when all our borders and everything is open, that people are flying every day? Thank you.
Thank you very much, Isimodu. I don't know that doctor has answers to those questions, because I mean, you're just a physician.
Yes.
Yeah,
but,
so
Yes, I'm a physician, and then we are also involved in taking decisions. We advise ourselves. If you don't know, we have had heated discussion whether to go into lockdown in Kaduna or not. But at the end of the day, we said no. We have learned a lot from lockdowns. I did mention a bit about it. Economic hardship, people cannot move around. You become militarized in a democracy. The freedom is all because we want to contain things, and it's because people don't take advice. I want to correct the notion. The world at large has learned a huge lesson from the previous lockdown. It was a bandwagon, and there is an overhyping of the disease. We will have used our own peculiar problem to achieve our own lockdown. But that time we just followed. In Wuhan, they use the military, they block people, they shoot, they do all sorts of intimidation to allow people to comply. In the US and the UK, they also use similar efforts. But now we have found out that we need to be a bit more democratic and more friendly in the way we do lockdown. Like in France, Sweden, and UK, where there is resurgence, they impose curfew that from 6 p.m. to a particular point of time, you will not go out. You restrict people going to the bar to a particular number. So all these are coming up. And then it's true that UK is proximity to Nigeria is very high, and there is still flights coming. Just last week, Saudi Arabia announced that it has banned international flights. But this morning, they have reopened their borders. So we cannot live in isolation. I think what, like you rightly said from the beginning, preventive measures is the best form of measures to be taken. If you have to fly, you should have a test done. You should observe all the protocol. If they say you can't fly, please comply. People are now bringing out fake COVID test results. That's how wicked we can be in this country. Recently, the Nigeria Center for Disease Control in Nigeria published the names and passport number of violators, people who provided wrong addresses, people who were told not to travel and they traveled, people who came in and we say they should come. I mean, it's ridiculous. We must act responsibly. Government is doing its own bit, and then we should, they are kind enough not to have imposed serious lockdowns that it can be. And if we do not act responsibly, we will have ourselves to blame. So I want the government to further enforce and institute punitive measures for violators of the COVID rules in international travels, in land and sea travels. It must be restricted. Our borders are open. Economic activities must continue. Even bringing in the vaccines is an international travel. People will have to bring in the vaccines. So it's a collective responsibility by the government, ensuring the citizens do the right thing, imposing sanctions and restrictions and punitive measures for violators and offenders. And above all, we are adults. We should act responsibly. The Bible says, love your neighbor as thyself. That's what the prophet of God said. Even in Islam, he said, you are not a true believer until you offer your neighbor what you want for yourself. If you know that you will transmit this disease, why not act sensibly by using face masks, observing the protocol if you have to fly or travel? You are helping your neighbor, and you are just being godly when you do that. If you even look at it from that spiritual perspective, it's enough for people to act responsibly and follow the rules by the government.
Keywords there: be responsible. Everybody needs to be responsible at this point. Do not be the the mode or the carrier that would transmit this disease to other people. Let's all be responsible. Taking another call. Hello, good morning. Hello, good morning.
Hello, good morning.
Good morning. Welcome to Perspectives. What's your name?
Please, we have had.
We don't know your name. What's your name, sir?
Please, hello. Please, hello.
What is your name, sir?
My name is Chinenye from Tabo.
All right, go ahead.
Please, we have heard how the doctor explained, and we have known that this is real.
Thank you.
But why the government ask people to go and queue for this national ID card by this time.
All right. Thank you very much. Interesting question there, Doctor.
Like you rightly said, I'm a doctor. I'm not a policy maker, but it's wise. I think it's wrong. The government, somebody made a joke and said, if you want to get COVID transmitted en masse, just go and see what happens at the new registration center. People are pushing, no protocol. People are pushing to get things done, because unfortunately, we like to adopt fire brigade approach to our issues. This is reflective of governance, and even to we the citizens. We do not make hay while the sun shines. We do not plan. We do not make. How can a government policy comes and say within 2 weeks, if you don't do this, this will happen in a pandemic? It's ridiculous. Now, because of the outpour of emotions and genuine cry from like Mr. Chinedu and the members of House of Assembly and representatives and people all over the world, that policy is wrong. They have brought out now that we can do some of this registration, download the form, do it online in the comfort of your home, and transmit and do this, and then by extending the I think the problem that happened was that the government was trying to tackle security challenges, and at the same time the pandemic is there, and they never really thought of the implication. We should also know that coronavirus is a very serious security threat, and is a global security threat, and it should also be treated as such. So, but while attacking the physical security, we should not in any way endanger our institutions by ridiculous pronouncement of queuing and doing all those things. We should do it sensibly and reasonably in such a way that protocols are observed, downloading the forms and extending the timing for the registration are put in place. This will go a long way to assist the masses. It's a good policy to fight security, but it is badly implemented. But government is taking heed now, as far as I'm concerned. All
right, son. Let's take another one. Hello. Good morning.
Hello. Good morning.
Good morning. Welcome
sir.
to Perspectives.
How are you?
Very well. What's your name?
Yeah, I'm Luka Adra from Rapido.
All right. Let's hear you, please.
Yeah, I just
Look at you're breaking out. We can hardly hear you. We would let you go now. Try to call us back if you can. We're taking more calls on Perspectives this morning. The numbers to call are 081 40,000 989 and 07087 800 989. Hello. Good morning.
Hello. Good morning, sir.
Good morning. Welcome to Perspectives. What's your name?
Mr. Bamboye from Mandu.
Mr. Bamboye, what's your perspective?
Doctor, good morning.
Good morning, sir. Mr. Bamboye, sir.
My concern is just about the religious cycles. Religious cycles. I don't know whether you sit with them one-on-one.
Yes, sir.
Because they are still looking at it as maybe they want to hinder the church, they want to do. And somebody that is alive that will give offering. Somebody that is alive that become a member of the church. Let's look at our religious leaders. Even when they are preaching, they don't even put this thing in their mouth. What are they telling the congregation? What are they telling the congregation? I don't know whether you sit on them one-on-one, because they are the people that are attracted to large crowd. But yet, and I watched a program over the weekend on the NTA, this social gathering of a theater in Kenya. I can't remember that marriage. None of them was only very field that were putting all these things on. So please, I don't know, the religious cycle, I always say, because you cannot say you have faith when you are disobedient. There's no faith in disobedience. There's no faith in disobedience. Even in the Bible, there are places like that people advise that they are not the doctor, but they must have doctor in their midst who give them idea, and also they pass it to Congress. Those who are sick, they apply they were healed. So please, they are religious. The cycle are the problem on this part. Them are still looking at it as with faith. With faith, this is not faith. Faith, there cannot be faith when they are disobedient.
All right, thank you very much, Mr. Bamboye. We're going to take another one, and before we come back to you,
yes.
Doctor. Hello. Good morning.
Hello. Good morning.
Good morning. Program is Perspective.
Francis calling from Marathon.
Francis, let's hear you.
Good morning to Doctor.
Good morning, sir. Mr. Francis, sir.
Honestly, the issue at hand is very challenging, comparing the nature of our nation and the way we do things here. Just like the last caller have just pointed at the religious side as his own concern. I myself, I look at it in a different perspective. Because, come to talk of it, our religion in Nigeria, to be frank with you, have not been the issue that bothers Nigeria most. And sometimes people shift things in a different way. If you are talking about religious places that gathers once or twice in a week, what of market that is 24 hours busy? What of the roads? What of other offices that people gather on a daily basis? We are talking of religious houses that gather only on Friday and Sunday. So have you been able to curtail it in the market? Have you been able to curtail it in schools and other public places that the government have the responsibility to fix first before looking at the direction of the religious side? If the market and other places are kept in the right direction, it's the same people in the market that goes to the religious places. It's the same of us that goes to that same market to buy things. I believe the person that just spoke now always goes to the market.
Mr. Francis, you can make your points without really.
It's okay. I'm trying to put some things clear here.
Thank you very much.
If we can be able to do the right thing on our own, religion is not a problem. Thank you.
All right. Thank you so much, Mr. Francis. Doctor, you want to respond to?
We have seen the two perspectives. Bangboye and Oga Francis have spoken from the religious background, different perspective. The bottom line is act responsibly. Be responsible. People go, we have engaged religious bodies and religious organizations. They are part of our media and risk management committee. We have brought them in. We have no decision was taken without involving them and even traditional rulers. So the first caller made a very beautiful contribution which people should follow very well. Act responsibly, follow the teachings of what God has said, to love your neighbor as thyself. Following instructions of the constituted authority is a religious obligation on everyone. This Mr. Francis that has also spoken that, well, religion is not really the issue that even people disobey when they go. Yes, that's also true. But I've noticed that when people want to go to the bank to withdraw money or do any transaction, they observe the COVID protocol more than any other places. Maybe because they have a check and balances and control. If you want to withdraw, I've intervened. People argue, why wouldn't I enter? I have to realize, look, okay, just go wash your hand, put on your face mask, and you enter into the bank. If you can do something like that too in our public place, it's difficult to control human. In marketplaces, in public places, please let's follow these simple rules of hand washing and face masks. And punitive action should be taken against all violators. People in the places of worship, to a large degree, they have cooperated because we knew the trauma we went through when we were made not to go for our congregational prayers and our weekly sermons. We are religious people in the country, but let our our being religious translate into obedience and responsible people. This is where we this is why we missed it. In the US, they say, in God we trust. It's part of their motto. They hardly go, they go to church like us, but they overtly didn't show religiosity. But they act sensibly, responsibly, and they have the love of their country at heart. So if you have the love of your country at heart and the love of people around you at heart, there will be nothing wrong in you using your face mask when you want to go to the mosque and washing your hand and observing these basic rules, whether in your place of worship, whether in your place of work, or anywhere you find yourself.
Dr. Musli Kolawole Odola, consultant, orthopedic and trauma surgeon, public health physician. Thank you so much for
Thank you very
your
much, sir.
time with us this morning. All right, this has been the program Perspectives, and Perspectives will come back tomorrow at the top of the hour 9 with more issues, as we love to talk about them here. My name is Iheanacho Prince. Please have yourself a very fantastic day.